Um, Good afternoon, bonjour à tous. Thank you for joining us. Merci de vous joindre à nous. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour donner une mise à jour sur la réponse de la Ville d'Ottawa à la COVID-19. My name is Kina Leclerc. I will be your moderator. Je serai votre modératrice aujourd'hui. Before we begin, I'd like to go over a few items. As usual, please keep your microphones on mute. In order to see the speaker view instead of the gallery view, click the top right button. Veuillez changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Reporters with accessibility needs can follow the stream on YouTube as well. Today we will be hearing remarks from Mayor Le Maire Jim Watson, followed by Dr. Vera Etches, Chief Medical Officer of Health, Médecin Public, and Anthony DiMonte, General Manager, Emergency and Protective Services Department, Directeur Général, Service de Protection. Available for questions from the media following the statements, we also have, disponible pour des questions des médias, nous accueillons aussi Donna Gray, General Manager, Community and Social Services Department, Services sociaux et communautaires, and Dean Lett, Director of Long-Term Care, Directeur Soins de Longue Durée. After we hear from the panelists, we will take questions from the media. I will call it alphabetically. You may ask one question with one follow-up. We will now be hearing from Mayor Jim Watson.
Great, thank you. Good afternoon, everyone. Bonjour tout le monde. Today is First Responders Day in Ontario. En Ontario, nous célébrons aujourd'hui le jour des premiers intervenants. On behalf of City Council and our entire community, we want to thank all of our first responders for their passion, compassion, commitment, professionalism, especially during this unprecedented time in our world's history. I want to begin by addressing yesterday's news concerning our long-term care homes. The issue goes beyond just visits at windows. On several occasions, as you've heard by now, visitors to the premises were not respecting safe physical distancing. I've directed our long-term care staff to work with Ottawa Public Health to come up with a solution by May 7th, earlier if possible, to enable families the ability to safely see their loved ones. The residents of these homes depend on contact, obviously, of their loved ones for their mental well-being. These new measures that our staff will be putting in place will ensure that this can be done safely for both the residents and the staff. Unfortunately, despite our best efforts of our staff, last night we received confirmation that an employee and two residents at the Peter D. Clark Center tested positive for COVID-19. I've been advised that they are in stable condition. The employee is now self-isolating at home, and the two residents have been isolated from their fellow residents at the home at Peter D. Clark. While this is the second employee in our long-term care center to prove positive, this is the first positive test of residents of any City of Ottawa long-term care homes. As you know, we operate 4. We've been proactively preparing for this eventuality and measures to prevent any spread. We're working with Ottawa Public Health for tracing people who were in contact with these individuals and setting out the next steps for more testing. Family, fellow residents, and employees have all been informed. They're also working collaboratively with OPH to follow their advice, as well as directives set out by the Ministry of Health and Long-Term Care. To the family and friends of long-term care residents and staff, please be assured that we're making every effort to protect your loved ones in the 4 homes that the city operates. The COVID-19 pandemic has financially impacted so many businesses and residences through temporary closures and literally thousands of people laid off, losing their job. I want to remind everyone that you can still apply for the Property Tax Hardship Deferral Program. Je tiens donc à vous rappeler que vous pouvez encore présenter une demande pour bénéficier du programme de report des impôts fonciers en cas de difficulté. Besides the main qualifier of suffering financial impact, your property assessment must be up to and no more than $7.5 million. Also, the owner's property tax payments must be up to date prior to the 2020 interim tax bill received in March. And the deferral would move your payment date to October 30th of this year. To date, we've received 828 applications, with 761 of those applications approved for deferral. That equates to $7.5 million in municipal taxes that would be deferred. To those property owners who have tenants, be aware that, like you, they may also be experiencing financial hardship. As a result, property owners who qualify but who do not pass on the deferral will automatically be deemed ineligible. That means all taxes, penalties, and interest would be expected to be paid immediately. We'll get through this, we will all get through this better if we continue to work together as a community. So I urge landlords to please pass along this deferral to their tenants. As a reminder, in order to qualify, you must apply before July 31st. Mais pour être admissible, il vous faut d'abord présenter une demande. The application is available on ottawa.ca/taxes. During this pandemic, we've also taken preventative measures to protect ourselves and loved ones from the virus. But there is no one more at risk in our community than our vulnerable populations. Dans notre communauté, personne n'est toutefois plus à risque que les membres de nos populations vulnérables. That's why I'm pleased that the Jim Durrell Arena on Walkley Road opens tomorrow, Saturday, as a temporary physical distancing space for homeless men over the age of 18. On Wednesday, I had a chance to tour the arena with Councillors Sudds, Cloutier, and Brockington. The arena will provide a safe place for this vulnerable population to rest their heads and get some sleep while helping them to maintain physical distancing and better chance of not contracting the virus. The McNabb Arena in Centertown continues to serve people who are experiencing homelessness or who are precariously housed. The arena was opened on April 24th by the Human Needs Task Force to provide shower and washroom facilities. Since opening, it's been averaging 12 users per day. Our city staff are on site with information and available social programs and services. Staff from Centertown and Somerset West Community Health Centers are also on site to provide crisis intervention and harm reduction supports. I'd like to offer my sincere thanks to the staff of these two centers for their tireless efforts in supporting our most vulnerable residents during this unprecedented time. Finally, I know it's been a long, tough 7 weeks for our community. Finalement, je tiens à vous assurer que je sais combien ces 7 dernières semaines ont été longues et difficiles pour notre communauté. But we are making great strides at planking the curve, and we're seeing the results in our efforts. So please continue to stay home, practice physical distancing, don't gather in groups, and have a great weekend, a relaxing weekend. And thank you very much for the opportunity, and forward to any questions you may have. Merci beaucoup.
Thank you, Mr. Mayor. We will now be hearing from Dr. Etches. Dr. Etches, if you don't mind starting over, you were muted.
Okay, yes, bonjour. Today, I'm pleased to announce that Ottawa Public Health and the City of Ottawa together are launching the first phase of a citywide engagement opportunity to hear from residents about our collective community response to COVID-19. We're looking to hear more about your thoughts, perceptions, and understanding of current restrictions in place and future measures related to COVID-19. Nous chercherons à en savoir plus sur vos réflexions, vos perceptions et votre compréhension des restrictions actuelles en vigueur et des futures mesures liées à la COVID-19. Cette plateforme d'engagement en ligne est appelée COVID-19. Partagez votre opinion. So this online engagement platform called COVID-19 Share Your Thoughts will allow us to learn how residents are making changes in their lives to protect themselves and loved ones, what their experience has been receiving and understanding information, what kinds of supports residents have accessed, ideas to maintain physical distancing into the future, and what is perhaps much needed right now, share some good news stories. The City and Ottawa Public Health are currently exploring how we can safely reopen the city in a gradual, phased approach while aligning with the Province of Ontario's framework for reopening the province. And while we're doing this, we must include feedback from the public. So the information we receive from residents will help ensure we develop a plan for this post-peak period that aligns with the province and meets the needs and expectations of our community as much as possible. Ottawa Public Health is also working with stakeholders like the Mayor's Office and city leadership, city task forces, health system partners, the National Capital Commission, and others to interpret and apply the anticipated provincial guidelines within Ottawa. So community and client engagement is one of the transformational initiatives in Ottawa Public Health's strategic plan, the way we want to be working. Engagement is a process to work with our community, not just for our community. And it ensures that the decisions we make and the work we do is rooted in the voices of our clients and partners. So I encourage everyone to visit engage.ottawa.ca/COVID-19 or participants.ottawa.ca/COVID-19 to participate in English or French. Please check back regularly because this will be an ongoing effort where people can continue to engage in the conversation over time. One other way that Ottawa Public Health regularly engages with our residents is through Facebook. And this week, we launched another moderated Facebook page called Aging Well in Ottawa. It's for residents 55 years of age and older and their caregivers. And this page has had a lot of interest in its first week. Ottawa Public Health staff will continue to be online from 9 in the morning until 3 p.m. daily, Monday to Friday. And this is to discuss timely health topics, address questions that people have, and support residents to connect with one another. Please join us online for this exciting initiative. Santé publique Ottawa a inauguré cette semaine une nouvelle page Facebook, Bien vieillir à Ottawa, destinée aux résidents de 55 ans et plus et à leurs soignants. Un employé de Santé publique Ottawa sera en ligne de 9 h à 13 h tous les jours du lundi au vendredi pour alimenter les discussions entre les résidents. Joignez-vous à cette nouvelle initiative stimulante en ligne. So lastly, we're now recommending that any residents of Ottawa over 60 years of age experiencing any signs and symptoms of COVID-19 infection seek assessment for COVID-19 testing. The full list of who's eligible for testing or in the priority groups is available on our website. So you can be assessed and have swabs taken for testing if that testing is needed at a COVID-19 assessment center or a COVID-19 care clinic. Enfin, nous recommandons désormais que tout résident de plus de 60 ans présentant des signes ou des symptômes de COVID-19 demande à être évalué en vue d'un test COVID-19. La liste complète des personnes éligibles pour le dépistage est disponible sur notre site web. C'est les groupes prioritaires. Vous pouvez être évalué et faire prélever des échantillons pour le dépistage si c'est nécessaire, dans un centre d'évaluation COVID-19 ou une clinique de soins COVID-19. Merci.
Thank you, Dr. Etches. We will now hear from Mr. Dimonte.
Good afternoon. Bon après-midi. First, I'd like to thank Mayor Watson for acknowledging First Responder Day in his opening remarks. Now more than ever, we recognize the incredible resilience, dedication, and courage of these professionals on the front lines of our COVID-19 response. Ottawa Police, Ottawa Fire Services are working tirelessly to protect properties and keep everyone safe across our city. The Ottawa Paramedic Service is also stepping up and will again be sending its paramedics to support the swabbing of residents and employees at long-term care facilities for COVID-19 this weekend in partnership with the Ottawa Hospital team. Last weekend, 24 paramedics were provided for both Saturday and Sunday, and roughly 1,700 swabs were taken in the community. As General Manager of Emergency and Protective Service, I extend a heartfelt thank you to all our first responders for protecting our community and keeping us safe and healthy during these difficult times. It's an honor for me to serve with you. Plus que jamais, reconnaissons l'incroyable résilience et courage de nos premiers intervenants. Remercions-les pour nous avoir protégés et de nous avoir gardés en sécurité et en bonne santé. As you all know, the weather in Ottawa has been unseasonably chilly with snowflakes flying over much of April. This delayed the growth of grass and other property maintenance requirements, such as businesses operating in these sectors were non-essential in the local context. However, today the Premier announced that as of Monday, May 4th, certain businesses and workplaces can reopen as long as they comply with strict public health measures and operate safely during the COVID-19 outbreak. Examples include garden centers and nurseries with curbside pickup and delivery only, as well as lawn care and landscaping businesses. Golf courses may prepare their courses for the upcoming season, but not open to the public. and marinas may also begin preparations for the recreational boating season by servicing boats and other watercraft and placing boats in the water, but not open to the public. Boats and watercraft must be secured to a dock in the marina until public access is allowed. A reminder that going door to door to sell services is currently not permitted and all residents and businesses alike should make use of virtual tools to discuss and schedule essential work. You can get more information by visiting ottawa.ca/COVID. We know the nice weather this weekend will also have people wanting to get some fresh air, and I fully understand how the restrictions and physical distancing have been difficult for many people and their families. But please remember that parks remain closed. You can walk, run, bike, or use a mobility device to pass directly through the park, but not engage in other activities or otherwise linger or prolong your stay. Vous pouvez marcher, courir et faire du vélo directement dans le parc, mais vous ne pouvez pas vous attarder ou prolonger votre séjour. Please do not congregate in groups and form gatherings. This can happen inadvertently when people go to a public place all at once. That is why we have closed certain access roads and parking lots at Britannia Park, Mooney's Bay, and Petrie Island. While the warm weather and temperatures may tempt you, please avoid these areas. Our bylaw team's first priority is to educate and provide warnings to residents, making them aware of these restrictions. However, if someone fails to comply, a fine may be issued under the Provincial Emergency Orders Act, which are in place to protect citizens and help us all plank the curve and spread of COVID-19. So please enjoy the weekend responsibly and remember to take care of yourselves and protect others. Merci.
Thank you, Mr. Dimonte. So now we will go to questions from the media. I will quickly do a roll call to see which agencies are on the line. If I've missed anyone, please let me know. I'm going to go in reverse alphabetical order today. So Pascal-Marie Dufour de Radio-Canada. Merci. Taylor Blewett, Ottawa Sun.
I'm here.
Josh Pringle, CTV.
I'm here.
Thank you. Julien Paquette à le droit, je t'ai pas oublié.
Oui, je suis là.
Merci. Joanne Chianello, CBC.
Yep, I'm here.
Thank you. And Chris Curry's 1310 News.
Yep, I'm here.
Thank you. So a reminder to remain on mute until I invite you to ask your question. So we will begin with Pascal-Marie Dufour, Radio-Canada. Pascal, il y a eu un problème avec ton microphone, je crois. Il semblerait que ton microphone, il va de mute à unmute continuellement. OK. Pascal, je vais aller à la prochaine personne. Si tu veux juste m'envoyer ta question par écrit, s'il vous plaît.
Oui.
Merci. Okay, so now we will go to Taylor Blewett, Ottawa Sun.
Hi. I'm wondering, when it comes to specific guidance around things like, under what circumstances you should be leaving the house, or if it's okay to gather in with another person outside of your bubble, like things that we really got direction from Ottawa Public Health when all of the restrictions were being put in place. I'm wondering, with things kind of now heading in the other direction, will we be looking to the province for direction on these things, or will that be from OPH?
Thank you. I believe it's going to be a partnership between the province and the local cities, bylaw and public health around what is law under a provincial order and what is guidance from a public health authority locally. And so I know that nothing really has changed yet in terms of the provincial guidance on the things that you mentioned. So the gatherings are still illegal if they're over 5 people. That will have to change provincially. The use of the parks is still not permitted under provincial law, so that will have to change provincially. The advice about staying home and trying to limit your interactions to your household is public health advice, because it helps us protect ourselves and it helps us protect the people that we will come in contact with, because we don't know who might have an asymptomatic infection. We know there are infections in our community, and so that advice has not changed either. I think that as we see what the province is doing to open up options for people to undertake activities where there's more of a risk of interactions with others, we need to think about how the public health advice also might need to shift and accommodate for what's happening in our community. And so I know that we do want to be able to have more social interaction. That's important for our health. We're not at a point yet where we've got the infection in the community under control. We have outbreaks that are very significant, and we need to make sure that we protect those populations. We are definitely seeing encouraging signs that the infection in our community is decreasing. But those counts of the laboratory confirmed tests are so far tests that are mostly of people who are in priority groups like healthcare workers and essential workers. That's why today we're moving into opening up the recommendation that anybody in the community who's over 60 now, please, if you think you have signs and symptoms of COVID-19, present to be tested so we can get a better idea of what is out there in terms of people in our community who might have the infection that don't belong to one of those priority groups. So it's a partnership. We'll keep watching various metrics, and the province will be making recommendations, and we'll be looking at what that means for our city. And I'll be making recommendations on the public health measures.
Thanks so much. And you did kind of answer it a little bit, but the decision to open up testing to those over 60, really what prompted that? What allowed this expansion in criteria? And are you hoping to include other groups down the road in the eligible testing groups?
Yeah, so the main reason why we're able to ask more people to present for assessment and testing is that our laboratory capacity has continued to grow across the province and here in Ottawa. And so we're able to handle more people presenting, to be able to take the swabs if needed and process those swabs in the laboratory. The idea is that it will be helpful for us to know about other infections in the community, to get a sense of more of the burden of illness that's out there as well. It helps us when we identify a case, we can start that case and contact management. So a person who's infected then may have contacts, and we can do the public health work of slowing down the transmission in those circles. And that can be helpful to limit transmission in the community more broadly.
Thank you, Taylor. I will go back to Pascal Marie's questions. Her first one is, quel est le bilan de la COVID-19 à Ottawa? Combien de nouveaux cas? Combien de nouveaux décès? So an update on the cases of COVID in Ottawa. How many new cases and how many deaths? Oh, you're muted.
Ok, je cherche pour les numéros. Aujourd'hui, ok, mais toujours notre chiffres sont pour la journée auparavant. Alors, pour avril, le 30 avril, nous avons 1372 cas confirmés. C'est 75 nouveaux cas depuis la journée avril, le 29 avril. Et pour le décès, il n'y a pas un nouveau décès entre les deux rapports.
Merci beaucoup. So her next question is, j'aimerais aussi savoir qu'est-ce que les autorités pensent des gens qui apportent de la nourriture et des cadeaux comme des lettres aux travailleurs et résidents des foyers de longue durée pour les encourager et les remercier. Est-ce qu'il faudrait interdire ces gestes? In English, how do authorities feel about people bringing food and gifts like letters to staff and residents in long-term care facilities to thank them and to encourage them? Should we discourage these gestures?
Maybe Dan Lett can answer that as the head of long-term care, Dean rather.
Dean, if you're able to answer in English, I can transcribe in French following the media avail.
Yes, we are allowing families to come in to drop off items at the exterior of the buildings. Non-perishable items are being welcomed in, clothing, letters that come into the home. We'll disinfect those items before they go up onto the units. So we are encouraging families to do that. We've had a number of organizations that have dropped off food items for our staff, recognizing their work. So that is being allowed into the homes at this time.
Thank you, Dean. Pascal Marie, je vais envoyer la réponse en français après la conférence de presse. So we'll move on now to Taylor Blewett.
Oh, I'm good. I got my questions in already. I don't know if I got mixed up with someone else.
Sorry about that. So we'll move on to Julien Paquette-Ledroit.
Oui, bonjour. Est-ce qu'on a déjà une idée de ce qui a pu causer l'infection annoncée ce matin au foyer Peter D. Clark? Est-ce que ça a un lien avec la situation qu'on a voulu régler hier dans les foyers en interdisant les visites même aux fenêtres?
Merci, Julien. I can repeat the questions for Dean if you need it, Dean.
Yes, please.
Okay, so Julien is asking if the new cases at Peter D. Clark are in relation to the efforts that you were making to prevent people from visiting their families in long-term care homes.
No, the incidences of positive testing in the home are staff and residents, and the virus was brought into the home through our staff. It was not by a visitor to the site.
Est-ce que ça répond à ta question, Julien? As-tu une question de suivi?
Oui, ça répond à cette question-là. Je voulais peut-être en comprendre un peu mieux cette décision-là. On a peut-être surtout la façon de la communiquer. Je pense que c'est ce qui a peut-être pu causer un peu la colère au départ. Est-ce que si c'était à refaire, on communiquerait un peu différemment cette décision-là, notamment en mettant l'accent sur l'aspect de la nécessité d'éviter les contacts, alors que c'était pas toujours le cas jusqu'à hier.
Okay, so Dean, Julien would like to know if you would have communicated the decision differently, and if you can talk him through the decision and how it was communicated.
Sure. The decision was based on our inability to maintain social distancing between our families, our visitors, and staff and residents. The decision was based on incidents that had occurred across the homes where visitors were not respecting the social distancing between residents and staff. With the warm weather, we're seeing additional visitors coming onto the site, which increased the risks for our residents and our staff in the homes.
Est-ce que ça répond à ta question, Julien?
Pas tout à fait. Il y avait surtout la question, au départ, ça a été annoncé dans des lettres aux proches des résidents. Et on n'a peut-être pas mis assez l'accent sur justement les situations où des gens ne respectaient pas les consignes. Donc, si c'était à refaire, est-ce qu'on communiquerait cette décision-là différemment?
Okay, so Dean, Julien, just to clarify, he was referring mostly to the way that it was communicated to the families, and whether if you were to go back, if you would point to the specific instances where families were not respecting the social distancing rules.
We had instances where families were coming to visit their loved one, and we have a number of rooms on the ground floor in our homes. And so people were touching one another through the screens, and also were observed kissing through the screens. So the distance was not being maintained. In addition to that, we have areas of the homes outside where our residents go to smoke. And again, visitors were coming in to visit, and they were not respecting the social distancing when our residents were on the exterior of the buildings.
Thank you. Maintenant, we will go back to Susan Sharing, is just joining us now. Do you have a question, Susan? Okay,
Sorry,
so
can you hear me now?
yes, we can hear you.
Sorry about that. I'm just another question for Mr. Lett on the, I don't quite when I eventually heard your message, as it, sort of transpired throughout the day, it made a lot of sense. I guess what a lot of us didn't understand is how it came across. How did the message that you couldn't go to the window, like, really this message is all about the same message we've all been living with, social distancing. So how did it come out that it was like not to go to the window?
So we support visits through the windows. That's not the issue. The issue for us was the social distancing not being maintained, and the families not adhering to the 2-meter distance with their loved ones, which, as you can appreciate, put everybody at risk with the virus being brought into the building.
I understand that, but the message we first heard was you couldn't go to the window, when in fact, which seemed, of course, it was understandable that, people, even Mayor Jim Watson said, of course he can go to the window. Vera Etches said, this isn't dangerous. I don't understand why families and their loved ones in these residences, why they had to go through that period of time when the message is really the same message for everyone: maintain social distancing.
So the messaging out to families actually highlighted about coming onto the property and our inability to maintain the social distancing. And we used the window visits as an example of why people were coming onto the property. But really, it was people coming onto the property and our residents being outside and the social distancing not being respected. The window ones that I'm talking about were open windows where there was a screen and people were accessing their loved one without respecting the social distancing.
So are we now just back to social distancing? They're still allowed to go, they're still allowed to see their loved ones?
Yes, we're putting together a plan right now across the 4 homes where we can safely support the visitation between families and residents. And it's going to be set up in a manner that we can supervise it. We can schedule it so that our staff are available to support those visits.
Okay, thank you very much.
Thank you. And can I just say one tiny thing? I hope I didn't come across harsh. This whole COVID thing has made me a nicer person. I appreciate that the message got mixed up, but I just wanted to make sure that, they're going to be able to see their families. That's all.
Thank you. Thank you very much. So moving on, we will go to Craig Lord.
Hi, this would just be actually a follow-up to Sue's questions there, and it's about bringing in supervision to make these visits possible between family and their residents. Will that require more resources, specifically personnel, maybe staffing the long-term care homes in Ottawa? And is the city and Ottawa Public Health prepared to perhaps lend those additional resources? Are they available to do that supervision at this time?
So this week we onboarded staff from Recreation Culture Facility Services, and those individuals were brought in to support the socialization for our residents with their families. So we were already in the process of bringing in additional resources for that purpose. So now those individuals will be available to us to support the visitation schedules that we'll be establishing within the homes. In addition to that, we had also increased our recreation staff within the homes in preparation for providing opportunities to connect between families and residents. And we brought in a number of iPads across the homes that are a wonderful opportunity for families and residents to connect via Skype.
Okay, great. There's no follow-up from me, so I'll pass the mic.
If I could just make reference to one point Craig brought up, the staff from Recreation and Parks are already being paid by the city. So in essence, they're being seconded and lent to the long-term care homes. So these are individuals that are already city employees on the payroll. Thank you.
Thank you very much. Moving on, we will go to Josh Pringle at CTV.
Thank you very much. We were wondering, looking at the reports, today was the first day that residents in a City of Ottawa long-term care home have tested positive, while over 300 residents in private-run long-term care homes. Does the City and Ottawa Public Health know why there's been so few cases? Is it based on the criteria you have in place, the procedures you have in place, luck? Any idea why there's been so few cases in municipal long-term care homes?
I might make some general comments, but also invite others. Dean, if you want to speak to the good work. Unfortunately, there's no one reason why a home will enter into outbreak or not. It is often more difficult in homes that have physical layouts that make it more challenging to control infection, where more residents are together in a room. These kinds of things make a difference in how an outbreak can start and spread in an institution. But all of the long-term care homes have received the same guidance from the province. Public Health has reached out to all of the long-term care homes to make sure they understand the changing guidance. Some homes have had more challenge with maintaining staffing required, and so have had to bring in people who may not be as used to the facility, as used to the processes. There's a lot of different things happening right now. But I do want to say that the City of Ottawa homes are always very good to work with, and we have a good partnership.
So I might just add that what we have done in our homes, and we've been following the directives from Ottawa Public Health, from the Ministry of Health, Ministry of Long-Term Care, and been implementing them immediately. We also, prior to the directive from the Premier, we were already initiating a process where staff would only be able to work in one facility versus multiple sites. The other thing we did was we did not bring in volunteers or additional resources outside of city staff to be supporting residents. I know some long-term care homes were in a position where they required resources, and they introduced new volunteers and workers to the work site. Again, I feel very fortunate that we have one home with residents that are positive today. We're going to continue to take every possible measure to ensure that our residents are kept as safe as possible, and we'll continue to work with public health to ensure all practices are put in place as soon as possible.
Thank you very much. Do you have a follow-up, Josh?
Yeah, just a quick question for Dr. Etches. You've launched the first phase of the public consultations today. Any idea on when you'd like to have these guidelines in place, or does it all depend on how the curve goes with hospitalizations and stuff like that moving forward?
This is a dynamic process, so we're going to take our lead from the province. As they introduce, the province introduces more information about what is opening up. For example, we saw a bit of an announcement today that some landscaping and outdoor work is starting up. We need to follow along and think about monitoring the impact of that. And you're right, the measures of the cases, of the hospitalizations, those things. And so I can't give a specific date about when it might change, for instance, to say, expand your household bubble, those kinds of things, I will certainly communicate as soon as it looks like that's a wise thing to do.
Thank you very much. So we will go to Joanne Chianello at CBC now.
Good afternoon, everyone. Actually, a little bit more on the long-term care home idea, maybe Dean, and I'm not sure about public health as well, so Dr. Etches as well. Do we see a time where the family's caregivers could come and visit the residents there? We know from there's caregiver advocates who are saying they need to get in there and do the things they do, right, for their patients, some of whom are very sick. And I was wondering if there's a plan to do that soon, maybe if they have PPE. I'm not sure what the criteria would be, but I was wondering if you could address that, please.
So maybe I'll speak first in that the directive right now is a provincial directive that only visiting is only allowed in very compassionate circumstances if somebody's, at the end of their life, and so it will have to be a decision at the provincial level that allows that kind of change. Now, if I was at the provincial level, which I'm not, I would be thinking about the risk to introduce the infection into the home. We all know, the City of Ottawa Homes, like others, it's their top priority is to prevent an introduction of the infection, because we know it can have such a difficult impact. We can lose lives. And so it's going to be related to the picture of infection in the community. If we think that the community infection rate is low, is manageable, then that's encouraging. That means there's less risk that something could be introduced into the home. I was looking at the data from Ottawa in terms of when we first started to see cases rise in the community, and it only took one incubation period, 14 days after that rise of cases in the community, for us to see the first healthcare worker in long-term care home affected. We're very connected. Healthcare workers are in the community, and so, we need to be careful. But absolutely, family members are hugely important from a caregiving perspective as well as the social connection. So, maintaining these other methods that Dean described are really important for now.
Thank you very much. Do you have a follow-up, Joanne? Or
Yeah,
Dean, did you want to
say? Hearing from Dean Lett on that as well. No?
Yeah, we're going to take our direction from Ottawa Public Health when we can reintroduce our families, our sitters, and caregivers back into the home. We are not going to take any steps without the direction from Public Health.
Okay, great. And now my second question is actually for the mayor. Mayor, you I think tweeted this morning about some tenants, commercial tenants being evicted. Can you talk a little bit more about that? What are you hearing from the tenants, and what, if anything, can the city do about that, or is going to do about it?
Well, I'm hearing from some of the BIAs that have told me that notices have gone up on certain buildings. I think a coffee shop, a Bridgehead coffee shop in Centertown is one example I heard of just an hour ago. And if BIA thinks it's helpful for me to call the owner or the mortgage broker, I'm happy to do that to try to persuade them to be reasonable. This was a notice, I think, that they had not paid their April rent. Well, we just ended the month of April, and obviously the business has been shut down for longer than that 1 month. So, we have some leverage with respect to the property tax deferral, as I mentioned in my opening comments, that if the landlords do not pass that along to their tenants, then they'll not be eligible for it. Other than that, we don't have any legal means other than persuasion and asking for their goodwill. I recognize landlords have expenses too, but can some compromise be reached with some of these small shop owners and cafes and so on? Perhaps they can work out a payment plan of a third or half of the money, until the locks get changed. I think that's the draconian approach, and my hope is that when this is all over, these businesses are able to get back up on their feet. But if they've been locked out of their premises, then they don't even have a fighting chance of doing that.
Okay, thanks. Just on an administrative note, is the website the OPH website being updated with the new numbers? Because I know, Dr. Etches, you said them in French, and we didn't want to ask you about it, but I just wondered if that's we can find that online somewhere.
Yes, you will be able to. I'm just bringing it up in English. It was 1,372 lab confirmed cases for April 30th. That's 75 new since April 29th. And there were no new deaths between April 29th and April 30th. And the challenge for us, right, why you see a delay in the posting, and it will be an abbreviated report for the next few days, is that we have shifted our case management reporting system. So we've gone from paper into a provincial database to an electronic case management system that will allow us to work without the paper and directly upload those results to the provincial system. So no data is lost. We'll continue to report, going backwards, we'll show you the full picture, but there's just not able to get the full reports up as they work on that transition.
I appreciate the update. Thank you.
Thank you very much. And last but not least, Chris Curry's at 1310 News.
Hi, question is for Mayor Watson. You've asked that city staff and public health look into reversing the window visits ban. Is this going to be a complete reversal, or will there be some adjustments? Because we have heard that some residents are not adhering to those physical distancing rules. So what does that look like in your eyes?
It's not so much the residents, it's the visitors, the family members that are not respecting the physical distance. What I've asked the staff to come back within the next few days is a plan that would allow people to continue window visits. We can't have people taking screens out and having contact with the individual, so that has to be respected. But there are a couple of issues that were lumped into one issue, and it got the most attention: the window visits, the smoking areas, people, residents sitting on the picnic benches, and then people, loved ones coming up and hugging them and kissing them and so on, and not respecting the physical distancing. So what I hope to see in the next couple of days, early next week before the 7th, is a plan that would allow us to make sure that people have the ability to come and see a loved one through a window. And I think the challenge is people say, well, why is it taking so long? Well, we need to put a plan in place, because unless you live on the first floor, you have to have staff bring you down from the second or third floor to the first floor so you can watch through a window and see your loved one. So we're not trying to be overly bureaucratic. We're just wanting to make sure that people understand not everyone lives on the first floor and has an accessible window. And that's why we want to make sure that we do it properly and respect physical distancing, but also allow those family members to see their loved ones and press their hands against the glass and be able to at least physically see the residents on that first floor window, or through that first floor window.
Perfect. And just a follow-up for Dr. Vera Etches, the province is discussing kind of their next steps with the economy. So it seems like things are maybe a few days into their 2 to 4 week plan into reopening. Does that look similar to here in Ottawa? And would you be able to say that the peak of the virus has passed here in the city?
I do believe we're in the post-peak period, as it's being called in Ottawa, as well as the province, when it comes to community-based infections. Based on the hospitalizations declining for a period of time, although there is an uptick in hospitalizations, it appears linked to long-term care homes. The challenge is we don't look at just one measure, and the province isn't either. So, if there's a lot of infection related to long-term care homes, then that is a problem for the community too. So we'll move carefully. We'll move in alignment and keep you updated.
Thank you very much. Thank you, everyone. This is all the time that we have today. C'est tout le temps que nous disposons aujourd'hui. Thanks for your time. Bonne journée.